glucose is 1.1 millimole per liter. So for the problem list, first is hypoglycemia. The diagnosis is milk insufficiency. This is because from the observation, she could not suckle milk from her mother because her mother always tried to avoid her when she tried to milk. So the plan is actually to monitor the blood glucose and to give bottle feeding. Second problem list is hypothermia, which is associated with problem number 1. So the plan is to monitor temperature and give warm water back. And for the third problem list is dehydration. Is associated with problem number 1. So the plan is actually to give food therapy. So for the treatment plan for first problem list, which is hypoglycemia due to insufficiency milk intake, bottle feeding, which is 20% of body weight, 40 ml every 4 hours was given for day 2 and day 3. And then bottle feeding firm leaf milk was given 40 ml every 6 hours from day 4 to day 8 to meet energy requirement. So for problem list number 2, which is hypothermia, so warm water bag was provided on the first day to provide heat support. And for the third problem list, dehydration, lactated renal solution 20 ml per kg, 40 ml subcut SID was given on day 4 to day 8 to rehydrate and prevent hypovolemic shock. So for the progression, the hypothermia resolved on the next day, and then 2 days later, the animal seems bright, alert, and responsive with thin mucous membrane, CRT less than 2 seconds, and skin tan less than 2 seconds. However, on 30th of November, now weight-bearing lameness at right hind limb was observed.
So for the updated problem list, first problem, hypoglycemia, which is diagnosed as milk insufficiency. The plan is to do monitoring, blood glucose and bottle feeding. And the second one is non-weight-bearing lameness at right hind limb. And it was suspected as insect bite, suspected stung by centipede because we saw the insect bite mark in the inguinal region, as well as we also noticed the presence of centipede under the rubber mat. So we also ruled out the second and the third problem, which are the hypothermia and also dehydration. So for the hypoglycemia due to milk insufficiency, the treatment given was bottle feeding for 40 ml every 4 hours, and then bottle feeding for 40 every 6 hours, which was done for day 4 until day 9, and then bottle feeding for of 40 ml every 12 hours was done from day 10 until day 14. Ketosol also was administered 0.5 ml intramuscularly SID on day 14. So it was as a vitamin B12 supplement. And for the non-weight-bearing lameness at right hind limb, sulfonamic acid 2 mg per kg was administered intramuscular SID from day 7 until day 9 as anti-inflammatory. And as for the progression, till 6th of November, we noticed non-weight-bearing lameness at right hind limb that is still persisting, and we also did blood glucose check that revealed 1.8 millimole per liter on 6th of November. So moving on to the discussion part. So moving on to the discussion part first, how are we supposed to know if the newborn kid is alive or dead? So first, we can check for the suckling reflex by inserting our finger in its mouth and see if it sucks. And second is a withdrawal reflex, which is done by pinching between toes and see if the kid pulls back those feet. And third is by gently like trying to poke the eyes and see if the kid moves away. And as for the management, right after kidding, first we have to check which are the airway, breathing, circulation. For the airway, we have to clean the mucus from the nose, mouth, and throat, and remove any obstruction, the obstructing airway. And second is breathing. We have to stimulate the breathing by gently inserting a piece of straw up the nasal passage, and if necessary, we have to perform mouth-to-mouth resuscitation. Third is circulation, where we need to check heart rate and mucous membrane color. So, and also we have to perform the clip, dip, and strip. Clip is for the umbilical cord to a length of about 1 inch to 1.5 inches, and dip, we have to dip the umbilical cord in 7% tincture iodine solution to prevent naval infection. And third is strip. It's teeth to remove wax plug in the teeth canal and ensure milk is flowing. And it is also important to help the kid get its first meal of colostrum.
So talking about the nutrition of neonates, it is mandatory for them to have access to the colostrum feeding. Colostrum is a thick yellow secretion from the dough that is present before and approximately around a week post-parturition. Colostrum is rich in maternal antibodies and primarily consists of IgG. The neonatal kids are required to ingest adequate volume of high-quality colostrum during their first hours of life to acquire transfer of passive immunity. The bioactive compounds in the colostrum will likely influence the newborn kid development and improve the metabolism. Newborn usually suckles the colostrum on its own, but at times it may be necessary to train it by putting a finger in the mouth while pouring a few drops of colostrum and then shifting the kid to the mother's udder. So upon colostrum feeding, we must remember these three cues, which are the quality, the quantity, and also the quickness. So in order to determine the quality of the colostrum, we can use colostrum meter. It is available in some countries and frequently used by many farmers. Colostrum meter is actually a hydrometer that uses the correlation between the colostrum density and also the IgG concentration. So if it shows green, it means that the colostrum contains more and equal of 50 mg per ml of IgG in it, and we can feed it to the neonate. If the reading is yellow, it is not meant for the newborn. It may be used for 1 to 2 days old kid. If it shows red, use it for the kid that is 2 days or older in age. Next, we can use Briggs refractometer. It could be either optical or digital to determine the quality of the colostrum. If the reading of the colostrum gives us 22%, then we can feed the neonate with it. The types of the colostrum that need to be avoided are the thin colostrum mixed with blood colostrum from the doe treated for mastitis, or those with a high bacterial count. And talking about the quantity, at least 10% of the birth body weight is required to meet the neonatal energy requirement. And quickness is all about the timing of the colostrum feeding. The ability to absorb antibodies will drastically decrease after 12 hours, and it is essentially gone by 24 hours of age. Therefore, if a newborn doesn't get colostrum within the first 24 hours of birth, the chance of survival are very slim. So we need to give at least half of the total amount within the 2 hours of the birth and the second half within 6 hours of the birth. Then, what should we do if no colostrum is available for feeding? So we can foster the kid onto another doe that has recently given birth. Let's say if there is no foster dam, a doe is available. So then we can use a commercial colostrum replacer, or after 24 hours, we can use milk replacer. In this case, Blossom was fed with milk replacer from the age of 2 weeks old, then was fostered by another doe named Ed at the age of 4 weeks old.
So these are the differences of colostrum compared to whole milk, where colostrum has high total solid, total protein, casein, fat, total minerals, immunoglobulins, and low in lactose. So how much milk need to give the kids? So 10 to 12% of the body weight of the kid. Until 2 weeks old, the total volume of milk should be split between 4 and 6 feedings per day and should generally remain on 4 feedings per day until the kids are 1 month old. And at this point, they can be fed 3 times per day. So moving on to the housing and environment, proper temperature must be provided to keep the kit dry and warm. So supporting heaters such as heating lamp, heating pad, bedding, and towel can be used, and be sure to install it safely and correctly. And do not let the animals chew the cord. And kids lose body energy very rapidly in cold or wet environments. As a result, they may become weak and die. And in Blossom case, warm water bag was provided, and we believe that this kind of heater more or less can increase the temperature of Blossom. Next is bedding. Soft, dry, and thick bedding need to be provided so that the kid will be more comfortable and not stressed, especially in rainy or cold weather. So there are several types of bedding, such as hay, straw, and sawdust can be used. And we need to change and top up the bedding regularly if the bedding is wet. So in aspect of safety, we need to provide enough space, minimum of 10 square feet to roam around, and also avoid crowded condition and separate the kid from others. And it also keep the newborn kid safe from predator or aggressive or older goat may attack the newborn baby. And in this case, Blossom, her twin and her mom, Bunga, was placed in a separate pen from other goats. So next is ventilation. A ventilation system must provide fresh air to maintain reasonable temperature and humidity, and also exhaust contaminants like ammonia. So goat kids should be exposed to proper ventilation and airflow in the house, either using natural ventilation or mechanical ventilation, such as fans to draw air out of the barn or push air into the barn. And some adjustment can be made if needed based on the weather. So next, then we need to keep the premise well lighted and not too dim, and also clean. This will minimize the chance of infections. Where poor sanitation and hygienic condition will cause a high risk of infectious diseases and parasites, especially to newborn kids. And to those who are weak or poorly fed can easily become infected. So that is all from us. Thank you. Any questions?
Okay, morning guys. I have few questions here. In your problem list, you stated that this kid is having dehydration, but you did not mention how much of dehydration. Okay, and then how did you guys determine the volume of the fluid given? Can you go back to your problem list table? Okay, so you mentioned that just dehydration, but you need to determine that the percentage of the dehydration based on physical examination. Okay, and then how much the fluid was given? 20 ml per kilogram is based on what? Okay, so that's one question. Um, and then I think one of your differential was actually milk insufficiency. Okay. Um, you have discussed a lot in your discussion, mentioning about the colostrum, the management and everything. So how can you actually relate whatever that you have discussed? So all of that are actually theories. So how can you actually relate everything that you have discussed in your discussion with your case here? are you saying that this is a case of not getting enough colostrum or just milk? Okay, because I think when did the problem started? At how days old or how weak? How yeah? What was the age of the kid here when the kid started to have problems?
Blossom started to recumbent at 2 weeks old.
2 weeks old. Okay. So do you think it's actually a case of not getting enough colostrum, which is actually like filial passive transfer, or just not getting enough milk? Or maybe Blossom did not had like yeah, I mean it's true. I mean not getting enough colostrum or even milk. But do you think it's actually a problem of poor suckling reflex? See? So how can you actually relate? You have discussed everything in your discussion, but how can you actually relate back to your case here? And what can be done in order for you to prevent such thing to happen in the future?
Sorry, doctor, but for Blossom, actually, he's tried to suckling the milk from his mother, but his mother rejected him.
Okay, so do you think that this could be because of poor mothering ability? That could be a reason as well. Okay,
Yes,
because
doctor,
Um,
it could
yes,
be,
doctor, it could be.
and
mm,
another thing, doctor, to add on, uh, Blossom is a twin of another kid. Like she was born with another twin, but the twin did not have this problem. Only this Blossom have this problem where getting rejected by her mother and then was not able to mm, get the milk, enough milk. Yeah. So the other twin, he gets enough milk and the condition is pretty much good.
okay, so back to my questions in regards to your discussion points, and also what would be the survival rate for this kid then? What do you guys think? Thank you.
For now, we already found a foster mother for Blossom. So, and yesterday we let Blossom to get the mother, to get the milk, and he suckled by herself. So I think the survival rate is good because it's already suckled the milk by itself.
And for the first question where doctor asked how did we correct dehydration status, um, we 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 don't know exactly like when we started how bad was the dehydration, but we treated with 20 ml per kg per site. So and then we administered subcutaneous.
Morning, guys. Are you done answering the questions?
Yes, doctor.
Wait, my question is coming back to feeding, right? So can you tell me how much are you guys actually feeding? Like because based on what you're writing here, what you've wrote there is like 20%, 40 meal every 4 hours. But then the next time also is 20% of body weight, but still 40 hours, but lesser frequency. So I just want to know, are you guys feeding the can you explain a little bit more, like how heavy is Blossom? And if you have a picture, you could at least show to everyone what's the difference between the twins. Blossom is more like a runt, isn't it? The mom has been kicking her since earlier on, and she hasn't been getting enough milk. So, but are you guys feeding enough? So what can you advise? What is the proper thing? What's the best way to feed? Or how much is, because if you go out and practice, how are you going to tell the farmer how to take care of a neonate, isn't it? That's the whole point of doing this. So can you advise, like, even though, like you've been, how many days have you been in the wards?
Actually, we have been in the work for 7 days, and this treatment is actually being given before we
Yeah,
came to the ward.
yeah, I know, 7 days, right? But there's so many of you, you could at least calculate, isn't it? So can you please tell us whether the amount that you've given is sufficient or not? Because you see, you give 40 meals every 4 hours. That's what, 160 meals per day. But then after that, you give 40 meals every 6 hours. So is that sufficient? And what is the body weight? You didn't even share what's the body weight of Blossom, right? I mean, you presented well, like all the notes, all the theory is there, but are you practicing it? That's the thing. So what can you advise? What can you advise? Do you think we are doing the proper regime? Do you think we're feeding enough to her?
Okay, so doctor, the treatment is actually all these treatment, 40 ml every 4 hours and 40 ml every 6 hours is being given from the previous group. So actually they give 20% of the body weight, but from our reading, we should give actually 10 to 12% of the body weight. So actually the body weight of the Blossom is 1.6 kg. So we should give at least 162 to 192 ml per day. So in this case, from what being given from the previous group, they give 40 ml every 4 hours, which is about 160 ml for the first 2 days, and 120 ml for the second for the subsequent treatment. However, this is actually not enough because the required feeding is actually should be between 162 ml to 192 ml per day, which is if we give TID, it will be around 60 ml every feeding. So this is
Isn't it?
actually enough, doctor.
Yeah. So sometimes, and then can you tell me the condition of Blossom, the cage? I think it would be better if you share those kind of things, so then we can figure out what are the best way to improve, isn't it? Because I think Blossom is most of the time wet, isn't it, in the pen?
Yes, doctor.
So what is the best way to do about that? Those are the things that you have to see and you have to tell. You don't have to tell theory, it's no point. Even if it's large animal ward, if it needs to be improved, you just have to mention, right or not? That's the whole point of having the discussion, right? So what else do you think we can do to improve in the large animal ward?
I think, doctor, for this one or the kid, we have to keep the kid in with a good bedding, so which can cover the body, and then it will conserve the heat. It will not lose heat a lot. That's one of the things that we can do, because right now, from our observation, there is no proper bedding for newborn kids, so they are on the wet floor all the time. So that can be.
Yes. And then what else do we need besides bedding? What else? You already said in your notes, that's why I said just um
So whenever we want to clean the pen, we can't let Blossom in. Maybe we can transfer into a new pen. And whenever we see Blossom is wet, we can wipe it using towel, make Blossom warm.
So yesterday, Dharani, I think you were there, right?
Yes, doctor, I was
So
there.
what did you do? What else did you guys do differently yesterday?
We wiped the body with towel, and then we found there was another doe recently parturited and it was having mastitis. So we stripped out the milk from the doe. We saved the milk and we fed the milk to Blossom. And also we tried to introduce Blossom to the dam, the new dam. It accepts Blossom, and it Blossom actually suckled the milk from the new foster mother. So the next plan is that uh, we can let Blossom to feed by herself with the foster mother. So yeah, doctor.
Yeah, okay, thank you. And then perhaps we have to have a proper heating source, isn't it? We like that as well, isn't it?
Yes, doctor, and also we plan to use hair dryer as well to
So
make
I mean,
Blossom warm.
that's the whole thing. Like you have to be alert. You have to see what you can suggest to the farmer. You know, there's certain practices that maybe they can improve. So you have to give suggestion. So it doesn't mean you just have to, give theory, but you just see what you can do and improve the situation, right? Thank you.
Okay, doctor. Thank you, doctor. Any question?
Hi, morning, guys. Mark here. Just want to ask, in regards to your evaluation, whether the kid is alive or not. Could you just go to that slide? Yeah, this one. This one, are you talking about whether, in terms of the fetus, the kid that's in utero, or the one that's already been born? My question.
This one is the one that right after kidding, doctor.
Oh, okay. Because usually right after kidding, I would think that you would have a stethoscope on hand and you can actually use that much better. Because sometimes after they are born, for example, if they had a really rough kidding or whatever, sometimes they might be apneic, or they might not have much reflexes, especially if it's a long dystocia. So if you just do these things and you don't see that it's alive, then you deem it's dead. I don't think it's correct. I think it's best if you can just auscultate for a heartbeat. Right. So you have a management rapid breathing. Can you just go back to the other slide as well, the same slide? Your evaluation slide. Yeah, this one. For Manners reflex, what do you understand by Manners reflex? For example, if you were to do a Manners reflex in a dog or a cat, would you do the same thing?
So normally, from my understanding, for Manners reflex in dogs and cat, normally we will try to
We do like
try
if we are
to
hitting.
put our hands close to the eyes and see if the dog or cat blinks from the reflex.
Yeah, that's right. So Manners reflex is to elicit a blinking response, right? So if you're going to poke the eyes, are you going to get a blinking response? Is that what you expect?
Yes, doctor. In this case, from my reading, it stated that Manners reflex in the kid is we try to poke the fingers in its eyes and then we see if the kid blink or the kid try to move its head away from our finger to avoid the danger.
Because typically Manners reflex is something that you don't really touch the eyeball with. And also because if you're trying to elicit Manners reflex, if it's a kid, maybe the reflexes are not really developed yet in order to get a blinking response. The reason why you're poking the eyes, I think it's because it's a noxious stimuli, so it causes pain, which is why the kid kind of like backs away from you. Could you just double check whether it's a Manners reflex? Because Manners reflex typically to me is what you explained, that what you did in dogs and cats. trying to get a blinking response by not touching the animal.
Okay, doctor.
Thanks.
Thank you, doctor. Any more questions? Is there any more questions? If there is no question, can we end the round, doctor?
Yeah, I guess you can end the rounds.
Okay. Thank you, doctor.